Well, the most common side effects of mesothelioma relate to the progressive involvement of the pleura by the cancer, that is the covering of the lungs, or the peritoneum by the cancer, that is the covering of the abdomen. And so in the case of the lungs, you literally get a thick rind, ever-thickening rind or orange peel of cancer encasing the lung, which leads to worsening shortness of breath. You can also develop a so-called pleural effusion, fluid in the chest that compresses the lung, and so one ends up with chest pain and shortness of breath. To try to cope with that, if one is older or not a candidate for more aggressive therapies such as extrapleural pneumonectomy, the removal of the lung, one might think about a so-called simple pleurectomy or decortication procedure where the thoracic surgeon goes in and just removes the pleura, thereby at least debulking to some extent the amount of the disease and allowing the lung to function more. The thoracic surgeon can also go in and drain the pleural effusion, the fluid around the lung, and that can improve the shortness of breath. As far as the pain goes, typically that's from involvement of nerves in the chest wall. That one has to deal with analgesics, oftentimes morphine-like analgesics, which can be a major problem for these patients. In the case of the abdomen, when one has involvement of the peritoneum, the inside of the abdomen, and fluid, you try to drain the fluid, and one can again try to debulk the disease in the abdomen. But that's a very major surgery and not one that many patients are suitable for. So coping often entails symptomatic relief, pain medications, drainage of fluid in the abdomen or the chest to improve breathing or distension and pain in the abdomen.